Hi guys, it's Heather. I'm going to try to make this a really quick video today because I'm holding the camera instead of having it on the tripod. So I'm going to start with my stats. Oh, and this is my 10 weeks post duodenal switch, lap band to duodenal switch surgery video. I had my lap band removed and changed to a duodenal switch, whatever, both mean the same thing, on November 9th, 2016 with Dr. Bermudez at Rex Bariatrics, and surgery was at Rex Hospital in Raleigh, North Carolina. My high weight was 304 pounds. My surgery weight was 283.2 pounds. My weight last week was 250.8 pounds, and shockingly, considering what happened this week, my weight this week is 246.6 pounds, which leaves me with a 4.2 pound loss for the past week. That's 36.6 pounds since surgery day, and 57.4 pounds since the beginning of this whole thing, which is pretty awesome. I'm very happy with that. This week, last week I had my period, and so I'd seen, oh gosh, it's hard. So I'd seen, so I'd seen 250 pounds on the scale, and then the day I weighed in, my sort of official weigh-in day, it was 250.8, and I was like, oh well, it'll come back down. And then the next day, it was 252 pounds. And then the next day, it came down a little bit, and then it came down a little bit. And then finally, I think just Monday or Tuesday, it finally actually started coming down for real. So really those 4 pounds were mostly, actually this week. So that's kind of good, I guess. I don't know. It was a little shocking to me that I was down this much for this week because of the way things had been going. So periods really mess with your weight. And my periods have been different, it's not really TMI, but like the whole thing has been shorter the past couple times, much shorter than I usually, fewer days. Very weird. Anyway, let's see. Let's start with kind of some bad news. I feel like I'm starting to see some hair loss. Not huge clumps or anything, but I certainly notice more. Sorry about the moving of the camera. I notice more, like I'll find little hairs on me, or like stuck to my face or on my clothes, which I don't normally find. I have kind of thin hair anyway, so the thinning hair is kind of a fear of mine. I hope it doesn't get super thin. I'll have to talk to my stylist if it does, see what we can do about that. For that, I did start taking Biotin. It hasn't really helped me in the past. Like I was taking quite a bit of it before I got pregnant, and then after I got pregnant, and then for a while after I had the babies. I kept taking like a good amount of Biotin, but it never really helped. Like it didn't help me not lose hair after I gave birth. Usually I had great hair, nothing fell out when I was pregnant, but then 3 months after the babies came, my hair started falling out. So that was, but it never got horrible. So I'm hoping that this maybe will do the same sort of thing, but maybe not. And so speaking of that, I haven't done any videos about sort of my vitamin regimen, but I plan to do that. I'm thinking about next time. So I fill up like 3 weeks at a time. I have organizers, and I fill up 3 weeks at a time. So the next time I have to fill them up, I think I'm going to film it, or at least parts of it, and let you guys see what my vitamin regimen is like. And also, speaking of vitamins, I see I'm sort of extra red right now. I take a couple of things. One is a prescription for MS that kind of can make you flush after you take it. Usually, I look like I've been sunburnt. My ears start feeling hot, and then I look like certain areas just look like I've been sunburnt. That lasts not too long, 15, 30 minutes maybe. Right now it's coming down. I don't feel hot anymore. So it's going away already. That can cause the flushing. And I'm also taking, I don't know if I mentioned it before, I'm taking spirulina to hopefully help with the hair loss too, or help regrow the hair, whatever it does. It's supposed to be good for that. And that also can make you flush. I don't know if it just has a lot of niacin in it or why, but I should probably look at the back of the supplement and see if it has niacin in it. Because I know large doses of niacin can also make you flush. And it seems conceivable that that is maybe why that makes you flush. But whatever it is, it sometimes makes me flush. It doesn't make me flush every time I take it, but today it did. Let's see. And then sort of on a good note, I'm still floored by how quickly I seem to be going through clothes. I mean, I haven't started going through any more clothes. I haven't gone to buy any more clothes yet, but the clothes, some of the pants that didn't fit me before that I'd started wearing are loose, and I'm not wearing them anymore. And then so I put them on, and I feel like they should fit, but they're loose, and it's weird because it happened so quickly. It hasn't even been a whole season, So I find that very weird. And I also find it weird that, so the clothes I'm wearing right now, the pants I'm wearing right now are pants that I wore when I was probably 25 pounds heavier, but they fit, which is kind of weird. So I guess my weight is distributed differently. It certainly seems to be not coming off my stomach as fast as it seems to be coming off other places. My wrists seem pretty small now. I have relatively large bone structure, but my wrists are much smaller than I ever expected. All my shirts are big, and I had to stop wearing some of the shirts. Shirts usually can go a little bit longer because if they're a little bit big, it's not that bad. Pants, if they are too big and they start falling down, then that's bad. But just I know that the pants that I'm wearing now, I couldn't have been this weight because I have not been this weight probably since college. So when I was wearing those, I know I was heavier. So I don't know if it's more muscle or less muscle, more fat. Maybe I was working out more then. Speaking of working out, I have not yet actually gotten on the treadmill because there's deadlines looming at work, and so I've been working in the evenings instead of doing what I should be doing for me. But that deadline sort of just passed, so there's at least a little bit more wiggle room. I don't feel quite so bad. So I haven't done that. Not doing so well on the goals so far, except for the weight loss. And just one more thing before I am out for today. I saw my neurologist on Friday. As I said, I have MS. And it was just sort of a basic checkup time, and I definitely wanted him to see if we needed to change my medication, because it is a pill and it goes through the digestive tract, and see if it's still being effective. So he took some blood, and I still have a bruise on my hand. They couldn't, for some reason, they couldn't get blood out of my, or at least she didn't feel comfortable trying to get blood out of, the usual sort of crook of your elbow place where they draw blood. So she decided to use my hand, and then they couldn't get, like, she couldn't get as much as she wanted. Like, it stopped giving her blood. And I think that's weird. It wasn't a fasting test, and I was not dehydrated, although I had a small cup of coffee that morning that was caffeinated, which I don't normally drink. But I forgot to ask for decaf. So anyway, I think I don't know if that's because of the surgery, or I haven't had blood drawn since before surgery. Yeah, probably right before surgery. But I have a physical coming up, and they're going to have to draw blood, and I have, my 3-month appointment with my bariatric surgeon coming up, and they're going to have to draw blood. And I'm not looking forward to that if it's going to be, because I know they're going to have to draw a lot of blood. So hopefully they will be able to get my usual good vein. I don't usually have bad veins or have a problem. They don't usually have a problem getting blood for me. So I don't know. I don't know if that's normal. I hadn't heard anything about that. Or maybe I was more dehydrated than I thought. I don't know. Anyway, so I saw my neurologist, and he, was surprised that there was less of me, so much less of me. In fact, the nurse weighed me and didn't write it down until we went into the room, and she was, pulled up my chart and was going to put my weight in, and she asked me if the numbers were right, because they were so different than the last time I was there, probably 6 months ago. So that felt pretty good. And the doctor, congratulated me and said that was good. And I told him, part of the reason I did this was because I don't want to be, if I become disabled, I don't want it to be harder for my family or whoever to take care of me. He says, I don't think that that's going to happen. That just doesn't seem, given how well I'm responding to the medication. And he said 2 years after that is a particular point of, sort of a decision point. If you're doing well after 2 years, that's good. And then 5 years is another one. So I guess I have 3 more years, and we'll know. And so I guess he feels like I'm probably going to stay at my usual disease level. So that's actually a really, really good news. So that's awesome. And yeah, so, and on a high note, my neurologist was happy for me and says that I probably won't be disabled. Of course, can't say for sure, but probably is good. But yeah, I think that's it for me now. I will see you guys next week.